The White House says the country has what it needs to track coronavirus's deadly spread 3 months after the first confirmed case and with a death toll greater than the Vietnam War. But as Washington correspondent Kyle Madura explains, some experts argue hundreds of thousands of tests a day don't amount to enough.
There's still no surefire treatment for coronavirus, but Admiral Brett Giroir says public health just reached a tactical turning point.
We are really quite confident that on a state-by-state basis, we have enough tests.
The president says about 200,000 tests are run each day,
the likes of which nobody's ever seen before.
That's a dramatic increase from the first weeks of the pandemic fight. Achieved, Giroir says, by fixing almost every link in the testing supply chain. But it still falls well short of the millions of tests per day recommended by outside experts.
Testing every individual American every few days is not a smart strategy. So instead of just doing a shotgun approach, we're doing a laser-focused approach.
The administration's blueprint calls on states to expand testing beyond patients to those most likely to come in contact with it, like nursing home residents and people living in tightly packed cities. The plan pledges support and supplies to coronavirus hotspots if and when state and local resources are drained.
It's way too late in the process to make that kind of process work. We really need federal leadership, and we should have had it months ago.
Emily Gee is a health economist with the left-leaning Center for American Progress. She argues the high percentage of tests coming back positive is evidence that not enough people are getting tested. Gee says leaders won't have a full enough picture to know if it's safe to reopen without the ability to track who sick people made contact with and at least 500,000 tests a day.
And that's really important for getting a handle on this outbreak.
Most states are in the process of reopening. Test results will help determine which states will speed up, slow down, or shut down again. Up next, beef supplies are starting to dwindle around the country, and that's changing the menu at some restaurants.